right, you guys, here we are. We're getting set up. It takes a minute. It always takes a minute. Always. So I'm going to go to new join. See, I think there's going to be. Let me invite you really quick.
Here, I'm going to send you a request.
Okay.
I feel like the last time I sent you a request.
So join request to join.
It worked.
Julie. Hold on.
Like, boom.
See, it just pops up. All right. Ooh. I don't know if that's going to work. I don't think that's going to work.
The feedback from this or the mic?
No, it's this.
That's what happened the last time.
Yeah.
Okay.
Yeah.
Back to square one.
Yeah. Okay. We're over here.
We're just going to do this together.
We tried to go separate, but that didn't work.
Did not.
Yeah, exactly.
Now you know you can't Instagram live next to each other.
No. But we have our trusty little mics. We have our,
Off to a great start.
I know. Hi, you guys. Welcome, everyone. We're going to wait for everybody to hop on, and then we're going to start our live tonight. It's going to be a lot of fun. Hi, Patrick from New York. Oh, I wonder if we have a little gal that listens all the time. She's from Switzerland.
Oh, fun.
I know she's from
I love
Switzerland.
That.
I know.
Trump is addressing the nation.
Oh, I didn't know.
We have great timing.
Yeah, we do. Oh, well. Oh, well. You know what? Here's the good thing about it is that it's going to be posted on my Instagram and TikTok and YouTube channel. So,
love that.
Yeah. Oh, that's too bad. We might have to. Oh, Long Island. Hi, Long Island. Oh, I got to invite Terry. Hold on. I'm sitting here. I forgot to invite Terry. There we go. Get Terry on here. Oh, yeah. I can. He is just like.
He sure is.
Boo Boo. Boo Boo has gas. Come here. Come here, Boo Boo.
He is.
Here comes Terry.
He's gassing us. He's gassing us.
There she is. She is. Can you hear us? I can't hear you. I cannot hear you. No. I know we're having technical difficulties. Okay. Huh, that's weird.
Oh, she's like muted.
Yeah, you're muted. Can anybody else hear us? Wait.
Can you hear me?
Yes.
I can hear you now.
Okay, hold on. Let me try this.
Okay.
I can hear you. Can you hear me now?
I can hear you now.
We can hear you.
No, I cannot hear you.
No, I can hear you. Yeah.
Wait,
I can hear you.
Yeah.
I can hear you. Okay, we're good?
Yes.
You're good.
Yay. Terry, this is Shelby.
Hi, Terry.
Hi.
It's nice to officially meet you. Of course, I watched The Golden Bachelor, so I'm a big fan.
It's good. I heard a lot of good things about you. If there's an echo, can you hear the echo?
I can.
Not on our end, no.
We can't.
Okay, there's an echo. I just want to make sure it's okay.
It says echoing. I don't hear it.
Let me take these off. This is better. I think it's because there's 3 mics.
Oh, you think so?
It could be on yours. Yeah.
Are we still echoing? Is there still, well, if it's us, then there should be an echo. Is there an echo, you guys? No.
I think it's with me. I think it's with me. I don't know why.
Because some of our listeners just said that Trump is, they said yes. All right, Sue, we need your help. So is there an echo, Sue, right now? Yes, there is. No, I have a yes, yes, and no.
Only with Terry.
Only with Terry. My poor Terry. That's okay.
These are working.
You're okay.
I don't understand. I don't know why.
Huh? You know what? Disconnect your headphones.
Yeah.
Disconnect the Bluetooth.
I did.
Okay.
Hang on. Let me try. I'll be back. I'll be back.
Okay. You'll be back. Okay. There we go.
Oh.
All right. Request to be, no. All right. Yeah, so normally this is a lot. So I guess everybody is watching the president address the nation tonight, we were just told.
Why am I always the last person to find
I
out
know,
about this?
I didn't know that either. I had no idea. But it's okay.
Is it
That's
because
okay.
we're just so busy? We just live in our own little bubbles.
Probably.
Yeah.
We don't have our computers on. I just have, the only thing I have on is my phone and our little mic.
Yeah.
That's it.
But are we echoing now?
Nope. Okay, Sue,
No.
are we echoing? Is it good? Thank God.
Sue, we're
Thank God.
relying on
I
you.
know, right? Let's see what she says.
Sue is a straight shooter.
There you go. I know, huh?
Mm-hmm.
Let's see. Sent a request to be. Oh, I got to invite Terry back. There we go. Good. Okay, Sue says it's good. You guys are fine. It was just Terry. Okay, thank you, Sandy. Yeah, they said we're fine. It was your audio, Terry.
So I took the Bluetooth off. Am I still echoing? I'm still echoing. I don't know why.
That's weird. That's really odd. That's okay. Just chill out, relax.
I'll just listen.
Well, you can, that's all right. We'll figure it out. It's not a big deal.
I can hear it. Yeah.
That's not a big
Love
deal.
it.
All right, you guys. So sorry about the president addressing the nation tonight. I wasn't aware of
No.
that. Sorry.
I apparently live in my own bubble.
So this is Shelby. She's the medical director here at her new Medspa in Las Vegas, Nevada. And she's also a nurse practitioner. And you worked in the ER room for how many years?
10 years
10 years.
hard. I call it 10 hard.
10 hard years.
Yes.
So what's interesting, you guys, and we were just talking about this. So me being on the streets as a paramedic firefighter, we had a thing what you called load and go. So if it was a really bad trauma, we would have to intubate them, stick the tube down their throat. Then we would have to give them an IV, right? Protect their airway, give them fluids, and then it's called load and go. And what we would do is put them in the back of the ambulance, and boom, we would give them to the ER nurse.
Drop them off to me.
Yep, drop them off to her.
Mm-hmm.
So it's funny, in our field, there is a real camaraderie between all the ER nurses, the firefighters,
All the first responders. Yeah.
There's a real bond between us because we see the worst of the worst.
Yeah, absolutely.
Right? I know.
We're all trauma bonded is what we call this. We term trauma bonding.
Trauma bonded.
We are
totally trauma bonded from what we did as a living. And then a lot of the nurses, like my partner on the bomb squad, Timmy, he married his wife was the ER nurse, and they've been married 35 years. So there's a lot of relationships that come out of the ER,
and
right?
all of my friends are married to firemen for the most part.
And you dated one.
I dated one for a long time, but we did not meet in the ER.
No, you didn't.
No, we did
But
not.
I bet you put out a lot of fires.
Yes,
Yeah.
100%.
Mm-hmm. But I will say, I actually came out of the ER with so many friends as far as EMS goes, fire, police, nurses. But what's so funny is I'm like such a girl's girl. I have so many female firefighter friends, like so many, and I love them. They're all badasses. I mean, come on, like you're badass.
It's what did you say? If you don't live it, you don't get it. Or what did you say? We were talking earlier. If you don't live it, you don't get it.
You just don't understand.
You don't understand. So it's nice to have that camaraderie in the field of, a lot of trauma, a lot of trauma.
And then I made a joke with Peg, and she agreed that we all bottle it in, and then when we would all go out together for drinks, everybody just would let it fly. Like it would just all come out.
Yeah.
That trauma.
And then it was like party hard.
Oh yeah. Definitely.
So it was a good time.
I wanted to be a trauma surgeon.
You did?
Mm-hmm.
Okay.
Yeah.
Okay.
I was in many calls, but one call, it was interesting to see the trauma doctor just split somebody's chest open, and they have what is that thing? It's a steel. You put it in your chest, and they just open it up.
Yeah.
Right. I don't
cracking chest. That's what I call it. Cracking chest.
And literally, the doctor put his hands right in that guy's chest and
started
massaging the heart. And
we used to do that too.
Yeah, it was. I mean, the stuff that we have seen, we should write a book.
I've seen a bedside craniotomy before.
What is that? I don't even know what that is.
Just take a piece of the skull off.
Stop it.
Brain
I've
swelling.
seen it. I've seen it.
Just in a hallway.
When I was in my residency for dental school, I'm echoing so bad. I'm just going to quit. I can hear it.
No, it's not that bad.
It's not that bad.
It's not that bad. I think it's
So
worse for you.
when I was in dental school, I had a residency at the emergency hospital. And I snuck out of the dental area and went to neurosurgery and watched the guys do brain surgery. The patients stand up or sitting in a special chair, and the doctors are back here just operating with rock music. It was bizarre.
Wow, it's crazy. Yeah, a retractor. Yes, a retractor.
You know, it's so, I think one of the craziest things I've ever seen, and this isn't even like gory or anything, a patient who is 4-point restrained to their gurney, which means that they were literally locked, both arms, both legs to the gurney, stand up with the gurney attached and run down the hall and run out the ambulance bay with the gurney attached to them. And I'm like, I'm not chasing that. Who's chasing that?
That's hilarious.
Yeah. I was like, I'll never see that again. It was so huge.
Yeah?
Huge. Yeah, well, those patients can take the gurney with them and take off running. So
Oh my God, that's hilarious. That is.
I am retired. Needless to say, I've been retired for a while, and yeah, I'm happy I'm retired.
Right. So I have one quick story. So a guy walked into the firehouse and he was complaining of a headache. He said he had a headache for like 2 weeks. And the guys were like, well, you know, do you want to go to the hospital? There's nothing we can do here at the firehouse, because a lot of people, they have what you call a walk-in, right? So the guys loaded him and you know, load and go, took him to the hospital. They did an x-ray. The guys came back from the hospital with the x-ray of this guy's head. He had at least 10 nails in his head. He was super depressed. He took a nail gun and he shot himself in the head like a week and a half ago. I know. And it's still hanging up in the firehouse to this day. I mean, the stuff is just crazy. It's crazy. So anyway,
Crazy.
so here we go. We're going to, first of all, I'm going to take everybody. I'm so sad that well, I'm not sad, but anyway, President, I know.
Yeah.
Oh, well.
It is what it is.
To do a quick walk around Shelby's Medspa. She just had her VIP opening this weekend, right?
We had our grand opening. We had, I think, around 300 people in attendance.
Yeah, it was absolutely amazing. So I'm going to follow you guys. Can I turn this around like some light?
Yeah.
Like this one?
Yeah.
Oh, wow.
We can start at the front. You want to start at the front?
Okay, yeah. So we're going to start at the front.
Okay.
So, all right. This is her beautiful med spa that just opened. So go ahead, Shelby.
So this is Estetica. So we are a med spa and a wellness clinic. So we have all the aesthetic treatments, med spa treatments. We also have a wellness side that is primary care concierge. We have a pediatrician who is concierge, and we have a physical therapist who is concierge. And there's a gym on the other side. There's offices, wonderful providers on that side as well. And then over here we have our check-in desk. So this is our front desk. This is our medical grade skincare on this side over here.
Hey, Terry, I think there's a lot of noise going on. If you want to turn off your volume, that would be great. There's a lot of noise in the lot. Oh, there you go. That's so much better. Thank you. Oh, just to do a quick for the wellness.
Yeah, go ahead. Yeah, absolutely. So you walk in the doors, wellness clinic is to the left, and the med spa is to the right. Yeah.
And we have Milburn here with us today. Right?
He's so sweet.
And then the waiting room, let's talk about the waiting room.
So this is our lounge where our patients wait for their providers to come get them for treatments.
Very pretty.
Yes.
Yeah, it's beautiful.
Come on, boo boo.
Come on, Boo.
Come on, buddy.
Are the dogs there?
Of course he is.
Come on,
Come on.
We are very dog friendly here at Estetica Med Spa. Come on. Come on, boo boo.
Now we're going to go.
So I will show you where the magic happened for Peg and Mel for their injectables. So this is one of the injectable rooms, mainly the room that I work out of when I am here in the office. And then we can take a little tour towards the back. So this is one of our laser rooms. We have a few laser rooms here, and then we have a few facial rooms as well. So this is the room that you guys saw Peg in yesterday getting her facial. And then we have another injectable room / laser room here on the end. So we have a lot of space.
A lot of space.
A lot of space, a lot of treatments.
Okay, thank you. It's gorgeous. It really, if you're in Vegas, you guys, it's Estetica. It's off of, tell me where it's off of.
Sahara and Buffalo, we're not too far from the Strip. We're only a few miles actually from Las Vegas Boulevard. So in an Uber or a Lyft, or if you're driving, we're maybe 10 to 15 minutes off of the Strip.
Yeah, so it's pretty close. All right. Let me show
So a lot of you guys are not local, so please come visit next time you're in Las Vegas. I mean,
Definitely.
who doesn't need an excuse to go to Vegas, right?
Right. And you're going to do a little discount, right?
Absolutely. Yeah, 15% off for new patients. So anyone who wants to come in while they're visiting, please do. Happy to have you.
Okay, great. And here's my little microphone. All right, so everybody has been dying to know what the heck did you do the final rose? Because I showed up and everybody swore I got a facelift, and I did not get a facelift. I got a Shelby lift. So explain, what exactly what we did, what you did.
Okay, so first of all, when Peg and I got together and I brought her into the Medspa, she said, I didn't know where they were at in their filming. I didn't know where they were at. So she came in and she said, I'm doing the final rose in 2 weeks. And I went, oh my God, 2 weeks is not enough time to prepare. So I really had to be strategic on the treatments that I was going to give her, because she didn't have the downtime to do some of the more aggressive treatments, which in my world, more downtime equals better results. So you can't get the greatest results without having downtime. Some of that downtime can be from a week to 2 weeks. She did not have the time for that. So I went, okay.
Staticky, too close to my microphone.
So
Staticky.
I went, okay, let's start off with some neurotoxin. So she had had it before, but she had never had Daxxify before, which is a peptide-based neurotoxin. They're all botulinum toxin type A. But the difference
what's the name of it again?
Daxxify. It's FDA approved. It's fairly newer. I want to say it's about 5 years old. And it has a formulated peptide that they make at their own lab that binds to the botulism. So it's a peptide that gives a radiant glow to the skin when injected, whereas Botox, Dysport, they have human albumin, which binds to the neurotoxin. So that's what keeps the neurotoxin intact and in place. So this is just a stabilizer as well, but it does have this ability to make the skin glow. So I use Daxxify on Peg. Typically, if I'm seeing a patient prior to an event, I like to do their Daxxify or their neurotoxin, whichever one that we choose, 6 weeks before an event.
6 weeks?
6 weeks.
Oh.
So when she told me 2 weeks, I go, okay, well,
Oh my gosh, it's 6 weeks.
we have no room for error. No room for error whatsoever. She's going on TV. So actually the first time that I saw how her Daxxify settled in was staring at the TV screen, watching the final rose, trying to figure out, okay, does it look good? Does it, like, I mean, you want to talk about like anxiety. Me as a type A personality provider, I was like, okay, I need to investigate what's happening here. And obviously it's going to watch anyways. But so we started with the Daxxify. Then I sent her to my esthetician, Jennifer, for a series of bio repeals. So those are 3 chemical peels. You do them 1 week apart in a row. So you come in once a week, you're here about 30 minutes for a series of 3. It's a chemical peel that peels from the inside out. So you don't necessarily get that snake peeling like you do with other peels. I love it because it's a peel that you can go into the sun. So it's not photosensitive. You don't get the peeling. You're not going to burn in the sun, and there's minimal downtime. So a lot of people don't like to do the hardcore chemical peels because they're peeling like a snake for 7 to 10 days. So this was a great one just to refresh her skin, get some dead skin off, fine lines and wrinkles. It makes the skin flawless. So
Is it
if
a
you guys,
topical that you place on?
yeah, it's a topical. Yep. And it stays on for about 15 minutes and then we take it off. So the whole procedure is like 15 minutes long. entirely. And so we did the series of that. I think we only got 2 in though, because we didn't even get the full series in. And then hydrofacials, and that was our secret. And then of course we talked about this too, me and Peg did. Good hair and makeup, you guys. If you have good hair and a good makeup artist, I mean, you can look like you have a facelift just with that. But for her, it was all tied together. We prepped her skin.
I disagree. I mean, hair, I disagree because I was so tired. I was exhausted. I mean, we filmed. You have to remember, I mean, I was gone for 6 weeks.
Yeah.
And we were filming anywhere from 10 to 17 hours a day.
Right.
I was exhausted.
Right.
And then when I got back from filming, Mel and I, what they do is they send you every 2 weeks to spend a week together in a hidden place, in a VRBO. Nobody knows where you're at, and you're, sequestered in this house. So I was just tired because there was so much traveling. So what you did was you just rejuvenated my skin. You really did.
Yeah. The goal was to lift the eyebrows. And keep in mind too, I like to be transparent with patients. Neurotoxins don't actually lift. We use the word lift very loosely, but when we release the actual muscle, it does give about a 1 millimeter release. So you're releasing the muscle. Botox doesn't lift anything. It does not actually lift. So, but when we release the muscles that are pulling down on our faces, we do tend to get that appearance that we have a lift. So I did do that to Peg. And she obviously had the radiant glow from the Daxify. And the bio,
I didn't tell you that.
It's amazing. It's a real thing.
Insane. It's a real thing.
It's a real thing.
You know what we should do? We should do one, like pictures before and then literally pictures after, because that is a real thing. My skin, I've never seen it so glowy. It was insane.
I just feel like we nailed the combo, right? Like the Daxify, the bio repeal, and the hydrofacial was just the perfect combination in a pinch. That I'm so sorry. What'd you say, Terry?
How long does it last?
The Daxify, anywhere between 3 to 4 months. So same as Botox. Yep. It's going to last anywhere. Some patients get lucky and say 5, but most patients on average are 3 to 4 months. I'm a 3-monther.
Are you a 3-monther?
I talk a lot. I work out a lot.
Okay. So
I move my face a lot. I animate a lot. So I burn through mine really quickly.
Okay. So when you sweat a lot, it does burn. You burn through it.
You can burn through it faster for many reasons, and that could be how much you work out, your metabolism. Right. If your dose isn't high enough, because dose equals duration as well. So if you're not getting the proper dose, it's not going to last you as long either. The depth of the needle, where it's being placed at in the muscle of the face, the injection technique. There's many, the right product for the right patient.
The movements, your expressions, the movements.
Yeah, but here's the thing: what I love, because of course I've had Botox before, and I would walk around like this.
No.
It wasn't pretty.
That's a no-no.
It wasn't pretty. And I was like, okay. But what you did was I would love to talk about, you did the bands. That was the first time I had the bands done.
So platysmal bands. Ooh.
I've had the first time, you guys. And I'm like, she's like, no, we're going to do this and we're going to do that. And I'm like, okay. But I remember you talking. So tell them what that does.
So platysmal bands, this is skipped a lot by injectors. Platysmal bands are important to assess on patients. Now, younger patients typically don't have bands that are pulling down like more mature patients are. Or if your patient works out a lot, they probably do have bands, right? So the bands, let me see if yours are coming back. So these are your platysmal bands, these little bands in the neck here. These are connected to your muscles in your face, your DAO, which also pulls down. So on Peg, I treated the corners of her mouth, which make a sad face, are these muscles here when you make a sad face. So these are all attached here. They come along the jawline, so I inject along the jawline. So as we age, our platysmal bands get tighter. When they get tighter, they pull down on our faces. So when we put Botox into the platysmal band, it releases the band so that we get a nice, beautiful lift. We look lighter in the lower face.
I think that's why everybody thought I got a facelift.
Yeah, you did have a beautiful
that. Yeah, like a little.
But also your brows. I mean, your skin. Everything just like it was all good. It was just good.
But I never had that done, so I think that's why everybody's like, "Well, she got a facelift. She got a facelift," and I think that's why.
Yeah.
Because of
but can I just tell you, as an injector, the biggest compliment is facelift allegations on my patients. So thank you to everybody that I was reading those comments for days afterwards, just laughing and sending them to Peg because they were so funny. She had to have how did she have time to have a facelift that soon before the final? I mean, they were great. So I'm so glad that we had these facelift allegations and that we can be here right now to confirm that was not the case.
Pictures and I'm like, holy, yeah, it looked good.
Yeah, she looked great.
Yeah, it's like, damn.
And you can even tell the difference from your hydrofacial with Jennifer to today.
To today, you guys.
And Jennifer is a great esthetician. She does the hydrofacials. She does the peels. I do most of the injectables, the plans of care for the patient. And then, yeah, she takes that ball and she goes with it. So
you know what I did because you go, Peg. Thank you. My lips, you guys, being in the sun, okay, working out in the sun,
living in the desert,
working outside my whole entire career. You know, I've got these lines and my lips are really always dry. So what did she do yesterday? She
the
did
lip
little
perk,
yeah.
the hydrofacial lip perk. Yeah. So Peg had a hydrofacial yesterday. If you guys haven't heard of hydrofacial, they're a machine that has an exfoliant that also sucks the gunk out of your pores. So it cleanses the pores as well, and then it pumps hydration back into the skin. And then you have boosters that you can add on, whether it's a chemical peel, a booster that has peptides in it, or something called a lip perk, which hydrates the actual lips themselves. But yeah.
Today I can feel it.
Yeah, the lip perk is amazing.
You can also, I'm echoing, so I'm not talking a lot. You can also use retinol around here that will help with lines as well, right?
Absolutely. And I encourage people to use a daily retinol every day. Every single evening when you go to bed, apply a retinol. But make sure you wear your sunscreen during the day.
What percentage? Because there's different percentages.
I use 0.25.
Yeah, so you have to be careful with the percentages. I don't want to say a percentage because everybody's going to be different. That should be something that you consult with your provider about. Every skin type, every age, everyone needs a different percentage of retinol. So I don't want to speak on a percentage because I don't want people to be using the wrong one and then it burns their skin or they peel from it. But there are retinols on the market. If you buy medical grade skincare that are safe for everyday use, that most patients will not have any peeling. So we're happy to post a link there. We have some really great ones though on the market.
100%.
Yeah.
And also, like, I'm in the sun every day. I love the sun. I'm not afraid of the sun. I love the sun. I am. I'm in the sun every day.
Not me.
But you have to wear your sunscreen.
Terry, you too. I am that weirdo in the shade, covered up.
I was a lifeguard growing up, so at this age, I'm no longer.
Yeah, I love the sun.
Terry, you look amazing.
She does.
She looks amazing.
So
she doesn't go in the sun.
I do vitamin C in the mornings, and then I do retinol at night. I also do a collagen peptide cream, and I do castor oil.
All at the same time?
Do you do it on your face or on your lashes and your brows?
No, I don't put anything on my lashes and brows.
Okay.
Castor oil, I started doing that.
On your face?
Okay.
Yeah.
But
I put castor oil everywhere. The body, I just love it. It's nice. Yeah.
Nice.
Doesn't it come off in your sheets though? Don't your sheets get all?
I don't do it at night. I'll do it in the day. Yeah.
Mm-hmm.
Oh,
well, that's interesting. Yeah.
And should you not wear makeup during the day or you put it on over the castor oil?
So when I come home in the afternoon, I get home around 3 is when I put it on.
Okay.
Yeah, I take all my makeup off and just put it on.
You know, I always say as long as you have a skincare routine, have some type of routine. Take your makeup off at night. So important. Take your makeup off at night. Put something hydrating on your skin. The more hydrated your skin is, the less aging it's going to go through.
Okay.
Yeah.
Tretinoin cream or stick to here's a question. Do you ever recommend Trenton, is that right?
Yeah, absolutely.
Or stick or retinol? What's stick? Oh, stick to, is that?
Or stick to retinol. So again, this depends on every patient is individual on your skin type. I would consult with a dermatologist or a nurse practitioner who's in aesthetics. I would go have somebody assess your skin and evaluate your skin, because all of these retinoids are different for each patient. So yeah, definitely consult with somebody who's an expert in the field.
So you do fillers as well, right?
I do. Yep. I do fillers, biostimulators,
What's a
neurotoxins.
biostimulator?
Sculptra. Terry, have you heard of
Oh,
Sculptra?
I have heard.
I've
Yeah.
had Sculptra.
Yeah. Do you love it?
Yeah, I had it 2 years ago, and it lasts a long time, right?
It does.
Where'd
Yeah.
you have it, Terry? Where'd you put it?
Right in here. I couldn't tell who did it. They go very deep. It's pretty cool. Yeah.
Really? Is that why did you put it there? Just to fill your face out a little bit?
Yeah, just right. The dermatologist thought it would look better, so I did it. But I mean, it's not something that's super noticeable.
I absolutely love biostimulators. I'm a huge fan. You have to keep telling your skin and your tissue to regenerate collagen. You have to. So if you're not a fan of filler or you're not ready for filler, biostimulators are a great alternative or a great additive to doing filler as well.
Interesting.
Yeah, biostimulators are great.
So Sculptra is a biostimulator?
It is. Yeah.
I did not know that. Can you explain the difference between that and filler?
Filler is hyaluronic acid. So hyaluronic acid we make and produce naturally in our bodies, but that is to fill. So the purpose of fillers is to fill the area. Biostimulators generate your own collagen.
Oh.
And fillers do stimulate collagen to an extent, and people will argue over this. No, it doesn't. Yes, it does. There's a lot of hearsay out there, but the studies do show that it does generate some collagen, but not as much as a biostimulator would.
So where would you put a biostimulator? Where would you put it in your face?
It depends. You can
Really?
put it. You can put it in your knees. You can put it in your chest. You can put it in your neck. You can put it in your lower face. You can put it. The only places you can't put it is your lips and under your eyes. There's certain areas we cannot.
Interesting. I never knew that. Some filler stays in your body for 12 years.
I've never seen that study.
Yeah.
It depends what type of filler. Now, I will say, I've done a lot of cadaver labs, and when we look at faces that have had previous filler placed, there are some brands of filler that do have byproducts that stay behind when your body tries to break them down. So this is why I highly recommend that you go to a well-educated injector who knows their products, what's in the products, how the products break down in the body, and what that looks like underneath your face. Because you do want...
Because she's you're lucky. She's very knowledgeable.
Oh, I know. I know.
Really good. Yeah. I wish you were here.
I mean, I'll come to you. Where are you at again? You're in Houston?
Yeah.
Oh, we're not that far. It's not too far. Not too far. But yeah, you have to know. Your injector needs to know what's going in your body. I cannot stress that enough. There are fillers on the market. There are fillers that people buy on Amazon that buy from China. It's so scary. And they go, I want my filler to last forever. No, you're going to do how long is this going to last? I go, 2 years. Oh, that's not long enough. No, you want your body to break these down. You want to have filler placed again after 2 years. You do.
Let's talk about the lips, because you know what? Is that Diana? Okay, 61, never smoked, but suddenly I have deep lines around our lips. What would you recommend? So here is what's interesting. Because Mel did what do we call it? Botox. He did a Botox. He was very, I was proud of him because
it was his first time. I popped his Botox cherry. I did. And he was so nervous. I was like, don't make me nervous. Why are you so nervous?
I gave her permission. You could do it.
But he, that was his very first time ever having Botox.
And he, because of course, being in the sun, playing football since he was 8 years old and wearing the mouthpiece and, and being 67 years old. So I said to him, I go, just try it, honey, just try it. So I really kind of talked him into it. And oh my, he's hooked now. He is hooked. because those deep lines that we all get as we get older, he really liked how they just smoothed all of that out. So trust me, he's going to be back.
He was so nervous.
He was so nervous. He treats his body like a temple. He only puts in
he should.
As he should, and he looks
all of us.
great. I know, and he looks wonderful.
He does
because of it. So he's always, he always is. Well, what is it? What is it going to do? And he wants to know everything about it. So now we're talking about the lips. So let's get back to that because I have deep lines around my lips from being out in the sun. So does he. So we're going to be doing something with Shelby with this.
Yeah, and like Diana, she's never, like my patients come, I'm so frustrated. I've never been a smoker. These are called smoker's lines. Why do I have these lines? It could be genetics. It could be loss of collagen. It could be using straws. I mean, it could be a million things.
Using straws.
Mm-hmm.
Wow.
Here's what I think mine's from.
I am not discouraging anybody from using straws because some of this stuff is just unavoidable, right? You got to enjoy your life.
Drinking out of a bottle.
That is true too.
Back in the day, we never had bottled water. Never. We drank out of the hose.
Right.
When we were
That's what's wrong with all of us.
Hose.
That's what's wrong with us, isn't it?
Well, you drank out of the hose. You were out playing as a kid. I'll be 63 in a couple of months. We're out playing. We drink from the hose, but all of a sudden, bottled water. And now what are we doing? We're doing this how many times a day? More so than a smoker because we're constantly. So I think that's where mine came from.
Yeah, but back to Diana. If you see somebody about your smoker's lines, I would suggest that hopefully they point you in the direction of doing a CO2 laser on your upper lip, which is an aggressive ablative laser. And then maybe some filler, some very thin, stretchy, movable filler to kind of help with those lines. But those should, this is a huge complaint that I see in my practice. It does take time to get these smoker lines to pop out. So you have to be patient with it. And it does take quite a few aggressive treatments for those lines.
If you do filler in the small lines, will it affect your smile?
No, it should not. If it is the right product, the right placement, and the right amount, and the right injector, it should be undetectable. So I live by the saying, an injectable should be undetectable. Nobody should know that you have injectables. If you look like you had injectables, then they didn't do their job the right way. Even when it comes to Botox, if you look like you had Botox done, wasn't done the right way.
Yeah, when I was walking around like this,
I would die.
It was so bad. It was awful.
Yeah.
It was awful.
Yeah.
Another question, Terry, do you do PDGF injections, and what is your opinion of those?
Platelet-derived growth factors. So this is an interesting topic, which I can't touch too much on. So technically, we do not inject PDGF. PDGF is meant to be topical. It is not approved by the FDA for injection. So PDGF, platelet-derived growth factors, is a more synthetic form of PRP. So if you think of platelet-rich plasma, and a lot of you guys have heard of a vampire facial where they draw your blood, they spin it down, and they inject your platelets back into your face. Think of this as a natural diamond versus a lab-created diamond. So PDGF is basically a lab-created diamond, but it is 400,000 times stronger than our own PRP. So it's an amazing add-on to any laser service, microneedling service topically. We put that on and it cuts your healing down by more than half.
Oh, wow.
Which is amazing. I carry it in my practice. I'm obsessed with it.
Really?
Obsessed with it.
Wow.
Yeah. Great product.
Well, thanks for that. That's a great question. Thank you.
Great question.
Hey, Peg, Mel wants to know if filler moves over time.
Oh, where is he? Wow, we got so many questions. Okay, anyway. Does filler move over time?
Yes, filler can move over time. Most fillers do migrate slightly, but it has to be placed in the right plane. If your filler is placed right, it's the right product, the right placement, the right injector, the right amount, it should not move. It should not move. Now, over time, or rough on our faces. It can move a little bit, but some filler brands move more than others. I'll put it that way.
Is that because they're thinner?
That's because there's more added byproducts. And if I want to get really technical and really scientific as a nerd, because I am a nerd, everybody, if you haven't noticed, they make their hyaluronic acid chains, they heat them and it breaks them apart so the particles move more. When the hyaluronic acid is in its natural form and the chains are not broken and it's not heated, it tends to stay in the same place. It doesn't break apart and it doesn't break down into byproduct.
That makes sense.
So that's why that's again, I always go back to, it's so important to know what products that your injector is using in your face, because not all products are good products to be placed into the face.
Diane wants to know what the favorite filler for natural looking lips.
Ooh,
Favorite filler for what?
natural looking lips.
Ooh, for natural looking lips. I am a huge fan of RHA, so Revance RHA Redensity in the lips, which is a very stretchy, movable filler that basically, if patients come in, I don't want an augmentation in my lips. I just want refreshed, hydrated lips, natural looking lips. It hydrates the lips. It looks so, so natural and moves naturally. It's hands down one of my favorite products I've ever used in patients that are requesting.
So what did I win in the drawing the other day? Because I won the drawing. I think.
You did.
Did I win the lips? Did I win the lips?
Oh, you won the hydrofacial.
So I won the raffle. That was so weird. That was weird. 300
weird.
people, and she pulls out my name, and I just put Peg on it. Isn't
With
that
Victoria
weird?
as my witness. I started laughing. I'm like, really? Out of everybody, no, I love you, but I'm like, out of everybody, really? And of course, she's not a normal raffle entry. It's Peg, no phone number,
No, nothing.
no contact information, no last name.
Nothing.
I already knew whose it was.
So I think I was gonna. There's 300 people. I'm like
300 people.
So I just put it in there.
Meant to happen.
Meant to happen. Okay, somebody
She just can't stay away from me.
I know that's so.
Not
true.
even the universe will let her.
No, not at all. Exactly. So I have a CO2 laser appointment next week for round 2.
Yay! I love to hear that. I love to hear that. I love CO2.
So why round 2 though?
Why round 2?
Uh-huh.
Well, most of these treatments, you don't want to just do one. It's like going to the gym one time. You're not going to get results going to the gym one time.
That makes sense.
Yeah.
Can you do a lighter? Because I had CO2. You're going to laugh. I had by Dr. Riffley. Have you ever heard of Dr. Riffley here in town? Dr. Riffley was a really big
He
plastic.
retired. He's retired?
Yeah, he's retired.
Yeah.
So very well known here in Vegas. He did everything in Vegas. So I went in the 90s. Yeah, it was the 1990s, and I did the CO2 laser, and it left demarcations for about 3 years on my face.
Wow. They've come a long way
Yeah.
since then.
They did.
I don't know that I would have had a CO2 laser back then, but
I know.
you know, aesthetic medicine progresses all the time.
Yeah, it does.
All the time. But our lasers that we have on the market now are prestigious lasers. They're amazing.
Do you have to be sedated for the CO2 lasers?
No,
Oh, you
no,
don't?
no, you do not. So you can, like a lot of surgeons will do them under anesthesia just because it's easier for them to go more aggressive on the patient. But we have every modality of numbing patients, whether it's topical lidocaine, nerve blocking the patients with injectable intradermal lidocaine, and tumescent fluid. And then we also use Pronox, so we use laughing gas. So our patients are always comfortable when we do these procedures. I never want anybody to feel pain. You know,
Unlike my job.
Yeah. Oh, yeah.
Right. Exactly.
Yeah.
Somebody said something about you using your own blood to fill your under eye and your under eyes.
Mm-hmm. They're probably talking about PRP. So their own
Okay,
platelets.
yeah,
Mhm.
exactly.
Yeah.
Let's see, Diane, let's see another question here. All good questions about natural lip. Okay, good. They like that. Let's see if any other questions.
All of your injectables should look natural. Anybody who's listening, please hear me out. All of your injectables that you get in your face should look natural. Everything.
Right.
Should never look like you had work done or just wasn't done the right way. It's unfortunate to see. I do dissolve a lot of work from other providers, and it's unfortunate when you have to dissolve it out.
Goodness.
But it's better to look natural and be conservative. It's also a red flag if an injector wants to do 10 to 15 syringes on you in one sitting.
No.
I always tell my patients, give me a year. Give me 1 year of consistency, medical grade skincare, doing your neurotoxin 4 times a year, 3 to 4 times a year, gradual filler, biostimulators, lasers, year plan. Give me a year. We're going to spread it out. Let's look at your before and afters in a year. They're going to look completely different.
Yeah, and that's what we're doing. We're doing
exactly
treatments.
Slow and steady wins the race, you guys.
How would someone find an experienced injector besides yourself?
Yeah, so you should vet them. You should vet them, and not just based off of their social media following. You should look at their before and afters. You should look at their Google reviews. You should look at their websites. You should go in for a consultation, meet them. Another huge thing, probably number 1, look at your injector. Because if your injector looks crazy, if they have filler blindness, you're going to look crazy. So go into the office, because everybody filters their pictures, and I want you to look at them. I want you to assess them. And I want you to ask them what they've had done. Truly.
That's a good point.
Truly.
That's really good.
I want you to vet them. I want you to ask them about their experience, where they went to school. Yes.
That's good. That's very good.
Yeah.
Because you look very natural. Very, I know you have a little lip.
Oh, absolutely.
Yeah, it looks, it's
absolutely.
I don't want the oversized lips. I just want it youthful, and you have very youthful.
I had no lips.
Very,
so here I am. Yeah.
So how long did it take you to get?
Oh, I mean, I've been getting lip filler since I was 24, 25. So
it looks so.
But I have dissolved over the years, restarted.
You don't inject yourself. You don't inject yourself.
I cannot answer that question, but
she will not deny, nor will she confirm.
But I will say that I have trust issues. So, and I am a solo injector currently at my practice. So I do help myself when it's needed. Yes, it's frowned upon. Listen, it's frowned upon. I wouldn't suggest to anybody injecting themselves, but I've been doing this a long time, and I've been injecting myself for a very long time.
Oh, you do a damn good job.
Thank you.
Damn good job.
But please don't come after me. I don't want any trolls coming after me.
Yeah, no trolls. Okay, is LASC the best laser? Is that lace?
What is LASE?
Yeah.
I'm sorry, I'm not familiar with that laser.
Yeah. Cummings, what is LASE? She's not familiar with that.
What?
So let's see the other
Another
questions you guys have. Let's see. Oh, microneedling infusion kit at home. Okay. What's it called?
I wish I didn't see that. I never suggest microneedling yourself at home or buying an at-home microneedling device. You put yourself at risk for so many issues. Scarring your face. Once you scar your face, you guys, you can't unscar your face.
Wow.
A scar is a scar. So please be so careful. Please.
I've never
that makes me
heard of it.
cringe.
What is that? What is a?
I'm not telling you.
Okay, don't don't do it, you guys.
Don't do it. Just don't do it.
Well, there you go. All right. How about the Tri-Halo laser gentle CO2?
So again, not one that I am familiar with. In my practice, I use Cool Peel, and I also use the Cyton Erbium CO2 laser. So I am not familiar with those ones.
So we're gonna do the cool. What you said you were gonna do with me? Just because
the Cool Peel.
The Cool Pill. We're gonna do the Cool Pill. So we're gonna do a series of CO2 lasers on Peg when she has some downtime. And from knowing you, I don't really. The downtime's not going to stop you from getting out there. It's not going to stop her. That's right. No, we'll
just as long as
what
you
about
stay out of the
estrogen
sun.
for the face?
For what?
The face estrogen cream, because it's a big it's a big crave right now. Estrogen on your face.
I don't. I base my knowledge off of clinical studies and evidence-based practice. I have not read personally, and if anybody has any, send it to me, please. I'd like to read it. I haven't read any evidence-based practice that suggests that estrogen cream is beneficial on the face and the neck. But if you have any studies that prove me wrong, please send them to me. I'm all ears.
Okay, here's one. What is this here? Do you
We
offer?
do not offer Keralays, no.
Okay. All right. MD. Here it
So
is.
we have Cool Peel, we have BBL Heroic, we have Halo, Moxie, we have the CO2 laser, so we have ProFrac, TRL. Contour TRL is the most hardcore. That's the most aggressive CO2 laser that we have. So we have a lot of the more aggressive lasers, but they get amazing results.
That's a big investment, all of these lasers.
They are, and one thing I wanted to bring to my practice was the best of the best. So there's a reason I studied all of these lasers. I met with the reps. I did my due diligence before I purchased my lasers. Yeah. There's a lot of things on the market that don't necessarily get good results. So you have to be careful. If it looks gimmicky or if it looks too good to be true, it probably is.
What's a good pro microneedling session? Equipment, serum, techniques.
So when it comes to microneedling, I would hope that your esthetician or injector is extremely trained on their microneedling device, which they should be. And most people use a glide when they microneedle, so there's like a lubricated glide in there. And they should have numbing cream. There should be a nurse practitioner, PA, doctor, somebody that comes in and meets you before your procedure. What was the rest of that question?
There's a lot to it.
Yeah.
Here it is.
So I have skin pen in my practice, and then the technique is going to be based off of the esthetician, but they should know what depths to use the microneedling device at.
So Diana, yeah, but I did my laser back in 1995. It was years ago. So the laser back then,
they were new.
They were very, very
and
new.
They didn't know what they were
doing.
Yeah, they didn't know how they were gonna.
And being light skinned, it finally went away, but it took about 2 years for it to go away. But it did leave some demarcation. But it was back in 1990.
They do not do that anymore.
Yeah, so don't worry about it.
Unless it's somebody untrained, then they should never do that to you.
This has been so informative. Very good.
And
good. Thank you. Thank you.
You'll have to come back on. So
I would love to.
Maybe in another.
I would love to.
Because we'll do some stuff and then you can talk about it as well. And what's interesting, you said you like to work with mature skin because you see the best results.
I do. Yeah. I love getting people with mature skin results. Yeah.
Old ass.
It is not old ass, not even close. You guys, I'm gonna pray to my lucky stars that I look like you guys.
You're not
gonna
hurt my feelings.
Like I'm not trying to. I look at her. Look at both of these women. I mean, is this not goals? But these are women who have taken care of their bodies and they take care of their faces. So this is a benefit that you reap when you take care of yourself.
Yeah. Maintenance, baby. Yeah.
Just what I've learned over the years is just consistency. Because I think people get on this like, oh my God, I want to eat right. Oh my God, I want to work out all the time. And what I have found, being almost 63 years old, is just consistency. Just be consistent.
True.
If you eat cookies one day, eat better the next day. If you have, a couple of drinks over the weekend, don't have drinks the next week or work out.
Yeah.
If you're going to go to the gym, you don't feel like working out, at least go for a walk for 20 minutes.
Yeah.
I mean, that's seriously.
Yeah.
I agree. Everything in moderation. 100%.
Everything. I agree. We all beautiful.
Oh, where do I start?
Oh, Debbie, yay.
Debbie, start with medical grade skincare and Botox. Nice and easy, conservative.
Right, exactly. All right. Any other questions, you guys?
For Terry.
To mix up the castor oil with what? Oh.
So you can mix it up with, it's not rosemary, it's rose hips. Rose hip oil.
Isn't it something?
I mix it with rose hip oil.
Do you?
Mm-hmm.
Wow, interesting. I know, huh?
Let's see.
Let's see. How do you get rid of them?
Perioral mounds.
I don't know what that is.
See?
Yeah, I don't know what that is. Peg, are you so you're inspirational of all your guests. I know, I love my guests too.
Aw.
I
You
know.
guys, I just want to say thank you for having me. I'm so lucky to be here. Like, I mean, what an honor to be on this Instagram live with you guys who are just very powerful, well-accomplished women. So
Yeah.
I feel lucky to be here with you guys.
Oh, I'm so proud of her. I mean, seriously, opening up
Yeah, you rock.
the Medspa.
Awesome.
I'm so
Aw,
proud of her
thank
because I know
you.
what it takes to have a woman-owned business, and I think that we definitely need to support each other.
Yeah. And you guys are
100%.
powerhouses, both of you guys. I mean, I have great role models. So
Where do you put the castor oil? On your face, all over her body. She puts it everywhere. Everywhere.
Well, almost everywhere. Guess you could put it here too.
Oh, God. Okay, red light therapy. What's your opinion on red light therapy?
I love red light therapy.
Okay.
The studies are there. The evidence-based
it.
practice is
I
there.
do.
I do it as well. I love red light therapy.
What do you have?
And well, I look insane at nighttime, by the way.
Do you?
Don't ever break into my house. You're like, wow. I have a red light therapy mask that I wear at nighttime a couple days a week. It goes on for 10 minutes. So it's the Omnilux mask is the one that I use. But yeah, I love red light therapy for the whole body is great too. If you can get into a red light therapy bed, red light infrared sauna, which we actually have here, all of these are great.
Debbie, I use IT foundation. I've been using it for probably about 15 years.
That's what I have on right now. We
Okay.
have the it. Well, it has the 50 SPF in it, so you don't have to worry about the sunscreen.
Exactly. I started using it when it had 4 colors.
And it hydrates your skin.
It does. I love it. I've turned
I
it
use-
on.
It's different from my nighttime foundation, though. Is it
I
different
use
for you?
toothpaste.
What? You have nighttime foundation?
Yeah.
What do you
Listen,
mean nighttime
you teach me how to
foundation?
use Instagram Live. I'll teach you how to use nighttime foundation.
Like you wear it when you go to bed?
No, like I wear it when I go out at night. Like my makeup at night is different than my daytime.
I thought that's when you went to sleep.
Oh, just like you can see your chin earlier when we were talking about the mic.
Did you see me at the mansion? I had no makeup on. No, I was in
I love that you are authentically yourself, though. I mean, that's one of the reasons why I'm so drawn to you, why everybody here is drawn to you, is because you're just so authentically yourself. And
the second
Terry, too. I would
Yeah.
say Terry is very authentically herself as well.
100%. We are. That's why
Well,
we're
we're
best
friends.
friends. We're best friends.
And
out
that's
of
why
the
you guys are
house.
friends.
Yes, exactly. How do you get rid of jowling?
Oh, jowling.
What is jowling?
Sucks. It's where this guy here.
Oh, when
They
oh,
little
oh,
jowls.
wait a minute. Hold this for a second.
We got some jowls.
Hold on. Hold on. Are you talking
About these jowls? These jowls?
these right here?
Yeah. Lasers. Filler to blend neurotoxins in the platysmal bands. That would be my answer.
Final answer. There you go. So true. Okay. Yeah. As you just get older, you just have to do a little bit of this and a little bit of
Little
that.
zhuzh here.
Little zhuzh.
Zhuzh.
Little zhuzh. And
Not too much though.
No.
More mature that like the aging process, you want to stay within that natural age progression.
right.
Yeah. Yeah. You want to preserve. You don't want to. None of my
Oh.
patients who are 60 in their 60s want to look like they're in their 20s. So,
Right.
you
It's
know,
not going to happen.
no. And if your injector tries to do that, you're going to get botched.
You know what we should do? Because everybody said I want to come to Vegas. So I am really good friends with the I know, right?
Yeah.
Autonomous Hotel, and it's really inexpensive. I think they charge like $100 a night. Autonomous. You've been there, Terry.
Yeah, it's
We
beautiful.
should do some type of event where people can fly into Vegas, right? Stay at the Autonomous,
Meet you guys.
right? Have a van, pick everybody up,
Absolutely.
and come over here and do an event. That would be a fun
That
event.
would be really fun.
That would be really fun.
That would be
Yeah.
fun.
Exactly.
I can always do consultations over FaceTime as well. They're a little bit more challenging, but I'm happy if anybody wants to do consultations over FaceTime.
Okay, so I'll put all that information in the
Yeah.
in the bio.
Yeah, but obviously treatments have to be in office. So
Right.
Yeah, duh.
No.
Can't do it over the internet, girl.
No, I know. I wish we could. Maybe maybe in another 100 years we might be able to
AI.
with AI. All right. Yeah,
All
maybe
right.
this is a great idea. All right, you guys. Well, thank you for everybody.
Yes.
for joining.
Terry, it was so nice to meet you. Thank you for having me, and thank you, Peg, for having me.
Of
And
course.
always love seeing
Oh,
you.
yeah, definitely. Stay tuned,
Yeah.
guys. We'll have her back on in about 30 days. We'll do some treatments. We'll see I'll come to Vegas.
Yay!
Maybe we might do that. That would be fun.
That would be so fun.
You know?
I'd love it.
Exactly. That would be so fun. So stay tuned, you guys. And this will be put on my page, on Terry's page, and
on my
on your page. We'll put in all the information that you guys need, and we'll have you back on in about 30 days.
I would love it.
That'd be fun. Thanks.
I would love it.
All right.
Oh, thank you.
Bye.
Bye. Bye. Have a good night.
Bye. Oh, Sean, bye.
Oh, bye.
Okay. And